that we have a solution to this crisis. There is a drug that is proving to be of miraculous impact. And when I say miracle, I do not use that term lightly. That is a scientific recommendation based on mountains of data that has emerged in the last 3 months. Mountains of data have emerged from many centers and countries around the world showing the miraculous effectiveness of ivermectin. It basically obliterates transmission of this virus. If you take it, you will not get sick. The most profound evidence we have is in the hospitalized patients. We have 4 randomized controlled trials there, multiple observation trials, all showing the same thing. You will not die, or you will die at much, much, much lower rates. Statistically significant, large magnitude results if you take ivermectin. We have 100,000 patients in the hospital right now dying. I'm a lung specialist. I'm an ICU specialist. I've cared for more dying COVID patients than anyone can imagine. They're dying because they can't breathe. They can't breathe. They're on high-flow oxygen delivery devices. They're on non-invasive ventilators, and/or they're sedated and paralyzed and attached to mechanical ventilators that breathe for them. And I watch them every day. They die. By the time they get me in the ICU, they're already dying. They're almost impossible to recover. Early treatment is key. I can't keep doing this. If you look at my manuscript, and if I have to go back to work next week, any further deaths are going to be needless deaths, and I cannot be traumatized by that. I cannot keep caring for patients when I know that they could have been saved with earlier treatment, and that drug that will treat them and prevent the hospitalization is ivermectin. I cannot call on more credibility than we have. We're not just a random doctor who's saying that we have a cure. Senator, the last thing I want to say is, you know who's dying here? It's our African American and Latino and elderly. It's some of the most disadvantaged and impoverished members of our society. They are dying at higher rates than anyone else. When you look at the mortality and morbidity of this disease, which is unparalleled, we are seeing countless deaths, and it's horrific the way they're dying. And you look at these safe and low-cost agents, it seems like a no-brainer that you should try it. I have done nothing but take care of COVID patients since the beginning. We have ICUs dedicated to COVID patients on ventilators.